Welcome back to the Carlos and Lisa Show. I'm Carlos Amezcua. As you can see, we're still experiencing this social separation thing, and Dr. Howard Gluss is here to talk a little bit about the anxiety we're all feeling because of this COVID-19 situation that seems to have escalated in these current days. Dr. Howard Gluss, welcome. Nice to have you here. Are we all feeling normal? Is this a normal feeling that we're all having?
No, I don't think it's normal at all, but I think what's going to happen is eventually when people experience trauma like this, there is a period where there's a normalization, and that's what we're all trying to do right now. Like, for instance, Carlos, we're communicating and attaching and finding a way to interview each other through social media. So that's an example of what's becoming the new norm. And people are connecting that way. I think it's very exciting.
So this is just kind of information management and communication management. For us, this is the way we're surviving with our business. But what's the best way to manage these kind of common fears that we all have about what's going on right now?
Well, I think one of the best ways is to ask ourselves, am I having a number 10 reaction to possibly a number 6 or 7 events? So, for example, what I mean by that is if you've experienced a lot of trauma in your past, the trauma that we're all going through right now can really escalate and go to a number 10. And if we start to know what the facts are and stay focused on the facts and try to get rid of the hysteria, it'll help calm us down and recognize I might be experiencing this in a stronger way than maybe I should be. And the best way to get through it is really that old saying, stay calm and carry on.
All right, but now, I mean, let's say this happened 35 years ago or 40 years ago, before social media, before internet, all this stuff. We're now so connected that we are minute by minute, second by second, knowing and experiencing what the world is experiencing, and it's really heightened our fears. So I guess disconnecting might be a good way to do that.
Exactly, because what's going to happen now with being connected so much, we go on overload. Yeah. And there's too much information at one time. It's like going into the freeway and going into a traffic jam. Exactly. Yeah. So when you feel that sense, it's just too much. I just did it today with a patient. I told them, stop watching the news. You'll find out what's important. Minimize it to a certain amount of time, maybe 20 minutes, but try to do something positive for yourself. Try to do something that's growth-oriented, because we're all at home now, and all those projects that we maybe haven't had a chance to do, I decided, there's a book I want to write. This is a perfect time because I ain't going anywhere.
Yeah, I was going to ask you, that was actually going to be my next question, was how to empower ourselves in a situation like this where we find ourselves somehow isolated and just seeing the four walls of our house.
Well, what I do to, on a personal level to empower myself is I start to think, I've been through stuff like this before, when 9/11 happened. In some respects, when the crash of 2008, It was a big crisis. So I try to go back in my own personal psychology and think, what were those attributes I used then? How did I get by in the period? And then I take those and I transfer them onto this period right now. And then I'm able to personalize it. And it really gives me a sense of control, not a sense of hoarding like with toilet paper, and we'll get to that, but a sense of control that I know how to run with this. I don't know day to day what's going to happen, but I know I have the tools to be able to run.
Okay, give me a couple of those tools. What kind? I'm just asking for a little bit of specifics here.
Yeah, sure. I think one of the tools is to not to catastrophize. So what that means is don't go to that darkest place. Try to find something that is specific and realistic to what's going on. So that's what I meant about finding those great moments that you can really focus on in your past and bring them to the future. A great tool is reaching out to other people. Don't limit it just because we're isolated, because in a lot of ways, we're not isolated at all. I go to a gym, and what we've done is the class that I go to, we're all connecting on Zoom right now. So it's been an interesting experience. It doesn't make me feel alone. I feel when people isolate, they can get into those really dark places. And this is not a time. This is a time to reach out.
Some of our viewers are going to be, and thank you for those tools, are going to be concerned because coronavirus has actually affected them or their families. And it becomes not them, it becomes us. It's actually in your home, in your surroundings, with your immediate family, within your immediate family group. How do you deal with that?
Well, I think the first thing is to recognize, at least from a psychological point of view, I'll address it from that angle, is don't put someone in a state of shame. They may already feel bad about getting positive with the coronavirus. You want to be able to minimize that because that's going to create anxiety for people. And as they feel anxious, it's going to be harder to actually heal yourself. So I would try to surround them with love and caring and not make them feel ostracized and not allow this to be a shameful experience.
Well, it hadn't even occurred to me that someone would feel like a victim, but I guess you would feel somewhat victimized by a disease like this. And you're right. I guess it's incumbent on everyone to be supportive and loving and really embrace them.
You know, people may want to, they may be afraid of telling people that they're positive. We experienced this back in the early 80s when HIV broke out. People were afraid to tell someone they were positive because they were afraid they were going to get ostracized. And unfortunately, that happens sometimes, and we have to make sure that doesn't happen again.
Let me ask you something that may be a little bit unorthodox for a psychologist, and that is the effect of prayer and faith and a belief in a greater power than yourself at this moment.
I think it's very important, and I don't think it's an odd question for a psychologist. I think understanding what we can control and what we can't, and then, like for instance, I know I can control what I work, but my work that I do, and how I choose to reach out to my friends. But I can't necessarily control a lot of that's going on in the world right now. So I feel like I give it up to a higher power to allow that there's faith and. Things have a way of working themselves out, and maybe there's some positive things that are eventually going to come out of this that we don't understand right now.
There'll be blessings for sure. But okay, finally, I want to attack the question of resources. People, even the president said, look, don't go to the stores and clean out the store. Why are we motivated to do that? And should people be that terrified?
Because hoarding, like, for example, I joke around with you, but everyone is asking me this question right now. Dr. G, what's with all the toilet paper? Why are people hoarding toilet paper? And I think because there's a lot of reasons, but when you think of our simplest needs, that's what toilet paper might represent. And if we feel like those needs are taken away, we start to create a state of anxiety. And hoarding is really about a way to control the world and a way to deal with our anxiety externally. A much better choice is to understand what you actually need and then get strong within yourself.
Well, Dr. Howard Gluss, we appreciate these words of wisdom, and it helps encourage all of us who are going through all of this, and we appreciate your expertise, and we'll talk to you soon because I think this is going to continue for a few more weeks. So thank you so much for being here.
I think it's going to continue for a while, and one last thing is people should stay connected but also be creative. Yeah. Also look at constantly how am I going to deal with this issue, this new issue that arises.
Thank you so much. Appreciate it.
Okay, take care, Carlos.
You too.